Please welcome Dr. Linda Lee, who's going to walk us through web apps and wearables, tools for joint health.
Thank you. Can everyone hear me at the back? That's great. So I want to thank the Arthritis Patient Advisory Board for inviting me to speak and welcome everyone online joining the session. Let me tell you a little bit about myself. So I am a physiotherapist, and I'm also a health services researcher. I like being a physio because I can help one person at a time, but being a researcher is really exciting because the things that I do can potentially help a lot of people out there. So exactly what do I do? Part of my work is to identify what are the gaps that are out there that need to be addressed in terms of providing the best care for people with arthritis. Then what we do is to set out to measure them, find out the gaps, and find ways to solve the problem. So some of our work include developing decision aids for people with rheumatoid arthritis to make better treatment decisions, ways to help people to exercise and to help them to be physically active. Then what we do is that we evaluate these treatments, these interventions, and hopefully it works and everything gets better and we help to solve the gap. So that's what I do every day and I love it. Now, so what I'd like to focus on a little bit is to talk about some of the new interventions and some of the projects that are involving these type of devices. There is no doubt that the use of digital fitness devices are becoming more popular these days. Now, in the past, these type of tools are usually used by technology enthusiasts only because the design is usually more focusing on the technology, but not so much about the usability, the comfort, or how they look. But things has changed in recent years when more companies are investing more money to design these devices for everyday use. So on your left, you can see this gentleman cycling wearing this really cool sunglasses. Those are Google glasses. And they don't look like high tech, but they're Google glasses. And there are a variety of fitness bands, smart watches that are available from various companies, and I think that's probably one of the big ticket items, for purchase over Christmas, if you end up getting one. And even the fashion industry is getting into the whole idea of sensors and wearables. Ralph Lauren, actually, debut what they call a tech shirt, which is a t-shirt that's wired with sensors that can take your heart rate, your body temperature, the distance you travel, how intense you work, how stressed you are. So right now they're designing for athletes, but in sometime in 2015 you can actually order it. You cannot buy it now yet, but apparently you can put your name up online. I checked. With the variety of these devices available, it's becoming more and more common that people are using it for a variety of reasons to monitor their activities. Just a show of hands, how many of them are using an activity tracker right now? So there are quite a few of you out there. So because these wearable devices have the ability to collect minute-by-minute information of people's physical activity, and a lot of them are also paired with an application that can give people feedback on how they're doing in terms of their physical activity, it gives tremendous potential to help people to monitor their physical activity and also to motivate them to be more active. The use of these type of wearable devices for arthritis care is still at its early days, but I think this whole trend, what we call mobile health or M-health, is just going to continue to expand because these devices are more available to people. So an area of my passion is to work with people with arthritis. For example, in osteoarthritis, one of the things that we know are that there are some treatments that everyone with arthritis should have access to in order to provide the best outcome for their health. We know everyone should be active, they should exercise. We know that for people who are a bit overweight should watch their weight, and if your pain control is an issue, some of the medications can actually help to control the pain. Many people know about them, but very few are using them. And we actually have the evidence. So several years ago, I had the pleasure to present at the ROAR event about a survey that we did in British Columbia with people with osteoarthritis. What we did was to send out a bunch of questionnaires and get about 1,700 back. Then what we did was to map them on what Dr. Westby talked about earlier, the quality indicators. And there are quality indicators for what is the minimum people should get for exercise advice and for weight loss advice. It was very sad. We found that only 1 in 4 in the province who actually need the advice, have no reason not to be physically active, actually get the advice. So here's the gap there. Now, we recognize that there are several reasons why people are not physically active. Part of it may be related to their symptoms, but sometimes it's also related to the individual. Motivation can be an issue. We all can relate to that. And sometimes people wonder, when my joint is so sore, and you ask me to move around and do all these exercises, are they actually going to be effective? Would it be more effective if I just pop a couple of pills? Right? And then people also worry that if I just go out and start doing things on my own, am I going to hurt myself if I don't have someone to guide what I'm doing? So one of the things that we did in a few of our projects is to develop a model to help counsel people to be physically active with the use of technology. What we did was that we have a physiotherapist provide information about being physically active. So it involved a session of a brief education about why it is good to be active and what are the things that you can do, ways to set goals. And then what we do is to give people a Fitbit Flex, something that I'm wearing right now. I think some of you also have it. Allison over there has one on her wrist if you want to take a look. As a tracker to track their activity and give people feedback. And then we have a physiotherapist to help review the activity level with the participant on a weekly basis at the beginning of the study so that people understand how to interpret those findings and learn how to set new goals and stay with it. So I'm incredibly grateful to do some of these work actually with a lot of support from physiotherapists, including Dr. Westby and some of her teams at the Mary Pack Arthritis program to help develop some of these interventions, including physiotherapists. So activity trackers, you probably wonder what they do. These are the sort of tools that monitor physical activity in a free living environment as compared to in a laboratory setting. It can be worn at the wrist, it can be a clip-on, or it can be worn around the waist. So there are different models there, and you can see some of them at the bottom. Typically, what they do is that they sample the acceleration of the body in different positions at a rate of about 10 to 30 times per second. So the position, if you jump up and down, it'll count it. You move forward, backward, you'll count it. You move side to side, you'll count it. And these activity trackers are not only tracking your movement, but also track your sleep quality. Some models are better than others. And a lot of them also allow you to put in information of your food intake. So it helps people who are trying to develop a diet plan for weight management. A lot of these devices also pair with an app and GPS devices, so you can actually track the distance you walk. And it has a social media component, which means that you can actually link up with your family or friends or other people with arthritis and set up your virtual group to be physically active, so they're pretty cool. So we've been incredibly lucky in the past years that we got approximately $1 million to do a series of studies using this particular model in a variety of conditions. So some of them are, the pilot studies are the ones that we're trying to set up the process. We're starting to roll out a series of studies in people with osteoarthritis. And you can see that in the middle column, who are the people that we are recruiting and the time frame for the intervention. So for the first 3 projects, the OA pilot, the monitor OA, and the super study, anybody interested in the acronym, I can tell you later, but not now. Come to me afterwards. We're looking at using the intervention at different durations. So some of them were 1 month in duration, some were 2 months, some were 3 months, so we can actually see how much we actually need, for the optimum effect. Now, you also see that on the right column that whether there's a new app available. So again, we're very fortunate to work with a group of computer scientists at Simon Fraser University. And they're building a new app that can help to visualize, to see the data more clearly about your physical activity using the Fitbit. So Fitbit data, the app development is open source. And you can actually use that to build your app and show the data in different ways, and that's exactly what we're doing. So some of the studies, we will use the company app. Those are the ones that says no, and the one that says yes, we're actually using the new app. So 3 studies with osteoarthritis, and 2 of them are with inflammatory arthritis, including rheumatoid arthritis and lupus. The last study is incredibly exciting. It includes people in the Aboriginal communities in Campbell River, Comox, and Cape Mudge. And so we're trying to work with that particular community, not necessarily with only people with arthritis, but the community identified that being physically active is something that they want to achieve. So we're going into the community to just test this particular intervention. It says we are recruiting, but it's more like we will be recruiting because we still have one little thing that has to go through from UBC ethics to say that we are recruiting. However, if you're interested in helping us with the study, Cam Clayton, the gentleman at the back, and Navi Gurwal, the lady at the back, please go to them for more information. And I would like to end by thanking the large number of people who are involved in the study, all the investigators, trainees and staff. We cannot get things done without them. In particular, the patient and consumers who are part of the project, as well as the Aboriginal community members who help us to shape the research project. And with that, thank you, and I'll take a few questions.
Can you hear me? Yeah. Okay, so I wore a Fitbit for an experiment for 1 week, but I haven't purchased one for myself. But I had trouble continuing to wear it. I always forget. What is the adherence rate of wearing physical activity trackers?
Well, that's a great question. With the activity trackers, it sometimes depends on the type that you use. So some of them are clip-on, and some of them, are wear around the waist, and some of them are waterproof, meaning that you can actually use it, when you're showering, and you don't need to take it off too often unless you need to charge it. So the adherence rate, sometimes it depends on the design of the tool itself. It's something that you have to take off from time to time. It's usually pretty poor. I know one of my colleagues, Dr. Michael Hunt, in his lab tried the Fitbit 1, which is the clip-on, and he said, I think almost half of them end up in the washer in the first week, because it clip on the clothing and you just go into the wash. So I think it varies quite a bit. Now, we did a pilot study with 10 people with rheumatoid arthritis last year, and my understanding was that the adherence was actually quite good. It was very good. For individuals, they like them, and people tend to use them for a long time.
Any other questions? Any more online?
Yeah, and for those of you who want the information from my slides, I'm more than happy to share. I should have said that at the beginning so you don't have to take notes like crazy. But just come to me. I'm happy to share them.
Thank you.
Thank you. Oh, we have a question.
In the absence of other people asking, I'm going to ask an obvious question. What is the goal of tracking? I mean, who cares? I know you are supposed to improve your physical activity. Mm-hmm. As a senior, I am less active than I used to be. Is that good, bad, or indifferent? Mm-hmm. So what is the objective or goal or the outcomes of the physical activity tracking?
That is a great question. I did not plan that question. So from the individual's perspective, using those trackers, because it gives feedback for individuals, and sometimes the information that they get back allow them to see how much they are doing, or doing too much or not doing enough, and sometimes people can actually use it to correlate with how they feel, you know, in for the rest of the day or in the following day. So it's a way to learn about what they do, how they move, and how their symptom looks like in the next day. So, and it also give incredible motivation, you know, for people to be active. Some of these devices give you congratulatory messages, little rewards that it may not sound a lot, but when my Fitbit actually buzz and tell me that I meet my goal, I jump up and down. So, yes, that's the next version. They need to give chocolate, I know. From the health professional's perspective, one of the reasons we decided to design the new Fitbit app is to find a way that the information is meaningful, not only for the patient, but for health professional to be able to use that information and counsel physical activity. For someone, for example, having an active flare-up, doing 10,000 steps a day, which is what they always talk about, you know, to maintain health, it's not going to be feasible, right? So having the information and the tracking actually helps to for health professionals to give better advice in terms of how to be physically active safely. Thank you.
Just like to add to that, that one way that I use it is not just for physical activity, but also to help to inform the titration of my medications. So I'm able to see how taking, when I have worse symptoms, be able to modulate that so that I can give my rheumatologist information that he can then inform when and how much of the medications that I take. So sleep, activity, and I think it helps with medication.
Thank you. Oh. Do we have
Okay, last question.
Okay.
Would it help, say, like on a good day you do a lot of exercise or you do a lot of activity, and then the next day you pay the price?
So the question is that a good thing that you do a lot in one day?
Or if you wore that,
Yeah.
and you're feeling like you're having a good day, so you do more, and then the next day you really pay the price, you can barely move. Would that help you to, I guess, moderate your activities in certain
Yeah.
ways?
Yeah, so whether it's going to help to moderate, you know, for not doing too much. You know, I think part of it is that the information that you get back as a user of the device helps you to learn about your body. You know, so what's doing too much for you may be different, you know, for the person sitting next to you. So it will give you, you know, some information that you can perhaps, you know, think about the next time when you're trying to be active or need to do a lot, and perhaps you actually want to, you know, schedule some downtime, right, so that you may have some time to recuperate, you know. So it's all a good feedback system. Thank you.